Welcome to MOBE Mondays.
Hi, my name is Yvette Moyo, and this is MOBE Mondays. MOBE is Marketing Opportunities in Business and Entertainment. Tonight, we are very excited to present to you this special program on men's health. And this is Men's Health Month. And for us, it is also Father's Day month. And when we say we, it's MOBE, Marketing Opportunities in Business and Entertainment, and Real Men Charities, the nonprofit that is the presenting organization for this forum. So we thank you for coming and we welcome you. It is my pleasure, and again, I'm Yvette Moyo, and I'm the founder of MOBE. My pleasure to introduce this panel on men's health and particularly focusing in on two areas that affect us, and they are stroke and prostate cancer. Tonight, our moderator is Rael Jackson, and Rael Jackson is on the MOBE executive team, and he is a young, gifted and Black executive that has managed many events and activities in the marketing industry with his Grand Rally company that managed the African Festival of the Arts activities, and of course, Real Men Cook for many years. His position is president of Real Men Cook, which is an annual Father's Day celebration, which features men serving, cooking, and serving the community. And cooking is synonymous with men's love and engagement with their families. It is fathers and father figures. So, Rael Jackson, I'm going to turn it over to you, and thank you for moderating this session of MOBE. And want to thank also, before I turn it over, AARP. AARP is sponsoring tonight's show and wants to help you get healthier and stay healthy. So we would like for you to visit AARP's Mental Health Center at www.aarp.org/mental health. That's www.aarp.org/mental health for tips, tools, and resources that can help you develop healthy habits for mental well-being. And at this point, Rael Jackson has been on the circuit with these men's health forums. And if you Google him and men's health, you'll probably come up with many sessions on the subject. But tonight, I'm going to turn it over to him so that he can lead this particular one. Thank you so much for being here. And it's a very, very important life-saving panel. And if you're not already inviting people to be on, I suggest you do, because we hope to save lives with this information. Rael Jackson.
Okay, thank you. I appreciate it. I'm excited for this important conversation. When I was doing my research, I found that African Americans, Black people, are 50% more likely to experience a stroke, and we know that there are definitely health disparities that we must address. So, getting ready to start this important conversation. First of all, I want to make these introductions. So we have some very important people here today. We have Cayman Kelly. His voice changed when he was 12 years old, and he started working in radio at 15. He is the host of Sirius XM's Heart and Soul weekdays from 12 to 6 p.m. He is a well-respected voiceover artist as the voice of other Sirius XM channels, Power 105.1 radio in New York City, nationally syndicated Breakfast Club radio show, ESPN Radio, Monday Night Football, and the NHL. He has also voiced promos for TV Land, Cartoon Network, TV One, Fox, FS1, Bounce TV, and more. He is joining us tonight as a stroke survivor. I'm a XM subscriber, so I understand the important role that he plays in our society, community, just entertainment space. Thank you for joining us. The next person that's on our panel, we have Dr. Deleshia Kinney. She is a Chicago-based public health specialist. She is the CEO and founder of the Health Education and Lifestyle Promotion Marketing Consulting Team, the Smiles Health Tool, and creator of Dare to Live Delicious, a self-care initiative. She specializes in working in integrative medicine, health promotion, and disease prevention. She is an adjunct professor at DePaul and Chicago State University, and one of the founding research associates for the Center for Cancer Disparities. Dr. Kinney is also joining us as a stroke survivor. We have Daryl Holmes. He is a retired Army soldier, having served 22 years around the world in Europe, the Kingdom of Saudi Arabia, Korea, West Point, and at the Defense Equal Opportunity Management Institute in Cocoa Beach, Florida. After his retirement, he attended graduate school at Texas A&M University, Central Texas, served on the faculty of Central Texas College, and on the City Council of Killeen, Texas. His career includes city planner, county planner, and economic development consultant. He is a stroke survivor and is currently being treated for prostate cancer. I think one of the most important things that can be stated here today is that everyone is at risk for stroke. It doesn't matter your occupation, your career path. You could be an athlete, professional athlete. You could be a doctor, and these things can still affect you. So I want to start with Cayman to just share a little bit about his journey. What was it like, when the stroke affected you? What were the after effects? Take us through your journey, please.
Oh boy. Just like you said, man, it could affect anybody. And I think as a result of that, sometimes we know that, but it's not a reality until it actually hits you. So, like I said, when we were on checking, it was something that I denied, and it was happening. I knew something was wrong, but I didn't know what it was. And I didn't expect it to be stroke either. So, I was sitting there taking the kids to the dentist, and they went into the office. I was sitting in the hallway, and I'm thinking, okay, I got to send some messages to some of my voiceover clients. So I was trying to literally type emails, and I couldn't type them. And I said, what in the world is wrong with me? So I go to the bathroom, and I was trying to wash my hands, but my body wasn't keeping up with my thoughts. So I'm thinking I'm washing my hands, and then the thought comes back around again, and I was just standing in front of the sink, and I was like, oh my God, I'm not really washing my hands. So I'm talking to myself like this, like I'm not washing my hands. So my right hand was numb when I left home, but I just equated it to me laying on my shoulder some kind of weird way, and the feeling would come back. So then when I sat back down and I started typing again, I started dropping the phone on the floor. And I dropped it again, then I put it in my pocket. I was like, okay, I'm gonna just sit here for a minute. But like all of this whole process, the kids come out, I make them another 6-month appointment. I get in my car, and I was just sitting there. I knew I had to put it in reverse, but again, like the thought processes weren't lining up with my body functions. So then I finally get the car in reverse. I drive home. I pull into the driveway, and I had to sit in front of the garage for a minute before I could navigate to get the car into the garage. And my first thing was like, okay, now I got work to do. So when I come in the house, of course, naturally, I start trying to work. But I was so off, like nothing was work. I could not get my hand on the trackpad to go up to the record button. And I said, what in the world is wrong with me? So I go over to the bathroom across from my studio, and I'm looking at myself to see if anything looks different. And I just started crying out of frustration, like, what in the world is going on? So my son came to the door, and he said, Dad, can you help me open this? And I said, give me a minute. My hand isn't working properly. So when I opened the door, he was standing there with this jar. And it was weird because I could grip it, and I opened it, popped right open. I didn't have any fine motor skills, but I had grip strength still. So he takes off, he fixes breakfast, he brings it back down to my studio and gives it to me. Then I noticed I couldn't grip the fork. I couldn't hold it. It kept dropping out of my hand. So I knew something was wrong. So I said, okay, I'm still in denial though. The only function that I'm noticing is my hand. I'm not even realizing there's a cognitive decline because I was in denial. So when I finished the breakfast, I said, okay, I'm gonna go upstairs. I'm gonna wash some dishes. I'm gonna try to get this hand moving again. So I go upstairs, and of course, we think like ibuprofen or some aspirin is gonna take care of everything. So I took the ibuprofen, hoping this hand. I said, maybe I got a pinched nerve because self-diagnosis is something that we're gonna automatically do too. So I said, okay, I got a pinched nerve. I'm gonna take this to loosen up, and I'll be good. So ironically, it was so crazy because when I came back downstairs, my son said, Dad, I got the dishes. Just go ahead and do what you got to do. So now I'm thinking like these kids don't never ask, can they do something? I got to ask them to do stuff. So I knew something must be wrong with me. I come back down in the studio and my wife called and she said, hey. And I said, hey. And she says, what's wrong? Now I'm thinking like, how she know something wrong? I haven't said anything's wrong with me. And I think that's tough because at first I wasn't going to confess, but then I said, okay, my right hand isn't working. I'm not having a good day. So she asked me a series of questions. I don't remember what they were. And then she said, did you dial 911? I said, no, I didn't dial 911. I took some ibuprofen. I'll be fine. And she said, ibuprofen, why would you do that? If you have a bleed, it's going to make it worse. So she said, okay, here's what we're going to do. If either you dial 911, I'm taking you to the ER when I get home. And I tried to think of every reason why I didn't need to go to the ER. I said, well, I'm about to take a shower. I'll see if I feel better. So she gets home and she asked me to grab both of her hands. And I grabbed them and she said, squeeze. And I squeezed them. And she said, that's interesting because it feels like you have equal strength on both sides, but your speech sounds slow. Go ahead and get some clothes on. We're going anyway. So long story short, they see a clot on my brain in an MRI. So he tells me it is life-threatening. You will be admitted to the hospital. Because I had this, to be honest, man, I had this man up mentality. And I started thinking about all the things that was necessary for me to do instead of saying, if I don't have the health necessary, I can't do any of this stuff anyway. So, laying there in that hospital that night, and she probably left around midnight or so. She said, I hate to leave you. I had to go home and check on the kids, make sure they're good. So she left, excuse me. And that next day when she came back, she was feeding me breakfast because I still couldn't use my right hand. And I remember her saying, she cut up these hotcakes and I ate some of those. And she said, I don't know about these eggs. You want to try these eggs? I don't remember anything after that. I went out. And when I came to, it was like all of these nurses in the room. I'm like, what in the world happened? I couldn't talk though. And mind you, I talk for a living. So you know how scary that was for me. I was aware that they were there, but I couldn't speak to anybody. And I kept trying to sit up and catch my breath. I was like, they said, lay back, sir, lay back, sir. But I wanted to tell them so bad. I just want to catch my breath. I'm not being combative. I see you here, but not to be able to communicate. That was like one of the most frustrating and scariest things that I've ever dealt with in my life. And they said, we got to do another MRI. We'll do a CT scan. Got those two things done. I still don't know what happened to me. And I still didn't know I had a stroke until I got home and I was having a conversation with my wife. So it was ischemic. And the neurologist explained, and he showed me the scans. And he explained it like the brain. So he drew this picture. He said, this is your brain. He said, consider this to be a garden. And then it was like a hose coming this way where the blood flow comes in to water the fruits and vegetables. It's one that goes out this way. So the clot that I had was in the back and it was on the right. It was on the left side of my brain, which affected the right side. So, and then I had a cognitive decline and it didn't hit me until I started. I know I'm all over the place, but it didn't hit me until my wife started driving me to the hospital because I was trying to type a message because I was supposed to be on the air. So I'm trying to type a message to my boss at Sirius XM to let him know nobody's going to be on the radio because I'm on my way to the hospital. So, and I'm trying to type this message and I could not type. And I kept seeing my wife look at me like that, but I would hold the phone up in the air and still act like I was typing. I was trying to be a man.
Oh, wow.
I'm still typing. Nothing's on the screen. So then we got to get closer to the hospital. And I said, oh my God, I got to call this dude now. So I called and I told him. And he said, okay, keep me posted. Not knowing that I was going to be in the hospital for the rest of the week. So they started me on blood thinners. And of course, they come in there and wake you up every 20 minutes or so. So it wasn't peaceful at all. But I had a seizure. I found out I had a seizure that morning when I was eating breakfast. And they think it was caused by irritation on my brain. So a couple of days later, you know how they show you, and you guys can attest to this, how they show you the pictures. And you're supposed to figure out what's going on in these pictures. I knew what was in the pictures, but I couldn't verbalize it. It was like Oh my God, it was so frustrating to look at them pictures. It was a mother that was washing, she was washing dishes, and then the kids on the other side was like stealing cookies out of the cookie jar. I could see it plain as day, but I couldn't say what it was.
Mm.
And then, you know, things started to slowly come back. And by the end of the week, I mean, I could still walk and I could talk and everything. And the therapy came in. They said, I don't see a reason why you would need occupational therapy. I went to my first therapy appointment, and my dexterity and my strength and everything was good. She said, I'm glad you came, but you don't need to come back. So I'm thinking like I'm on the road to recovery rather quickly. But you know, I mean, I still deal with the mental aspect of it all. I'm sorry, this watch is talking. I'm not even talking to her.
It's happened to me. It's
So, you know, I think it's more mental with me now, you know, and I realized, and I think that the positive thing that came out of it, it made me reflect and view life a lot differently,
Mm.
having a stroke. And I said, one of the things that I would do is I would use this as a testimony to other men because we have this mentality like nothing can ever happen to us. You know, we have that Superman mentality. And like I said, I've heard other people tell their story so many times, and you listen like, okay, I would never do that. But then when you're faced with that situation, you do the same stupid stuff. So I'm like, man, I gotta use this platform to be able to motivate some guys to get out of that mentality of just manning up. You can lose your life manning up.
this something that we have to hear because I mean it's very scary to me. What was it about your wife that did she have any special training or was she aware of stroke? You know what made her
Yeah. So,
um,
so my wife is a physician,
okay?
and
Uh,
you know, and man, I thank God for her.
mhm.
You know, and the reason why I say that because she's done so much, 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 so
Let me
much,
see
so
if
much.
I can pause that. All right. It seems like we're having a little bit of technical difficulties. We'll get him back in. And Daryl, can you share your story?
Where do I begin? I returned to Chicago from Texas. I'm an only child. My dad had suffered a stroke. I think he was on his second stroke, but I was encouraged to come home. So I was a city planner at the time in Nolanville, Texas. We had just had an election. My mayor had lost, so it was a good time for me to leave. I got hired at Cook County in the Bureau of Economic Development, and I was really excited about that. But during all that time, Pop had he ultimately was admitted to a hospice facility. He made his transition. A few months later, Mom was stricken with a stroke, and she passed shortly after that. So within 6 months, I had buried both of my family. That's the first thing. I had also during this time been planning a trip to China. Uh, we were doing an exploration trip. I was dealing with the environment and economic development at the same time. So I was trying to bring some wind turbine factories here. But anyway, a lot of stress, a lot of things going on. After I returned, let's talk about TIAs just for a minute, kind of building up. I left work at Cook County, downtown 69 West Washington, and came south and stopped by Popeye's Chicken. I don't eat Popeye's Chicken anymore, but while I was in the store waiting, I was overtaken by vertigo. I got dizzy. My sensations, I mean, I had to hold on. And luckily, I didn't lose my composure and I didn't lose my consciousness. But I got in the car and I went home without the chicken. And I called my uncle, who also lived in the building I lived in, asked him to come down. He looked at me. He says, "Man, your mouth is all twisted," and so forth and so on. But I called 911. They came and got me. They looked at me and says, "Well, your vitals are good. We don't see anything that might cause us alarm." But anyway, I did spend the night in the hospital, and they found nothing. They found absolutely nothing. About a month later, I did have a stroke. I was in my office. I had just left a meeting. I was on the 21st floor. I was making notes for a meeting I was going to have after lunch. I dropped my pen and couldn't pick it up. Could not pick it up. And I tried to get up to go to just to see what I could do, and I couldn't walk. My left leg was weak, so I sat there, and I was able ultimately to get on the phone, and I called one of my guys around, and he said, "Damn." He looked at me. My mouth was disfigured and so forth, and so my speech was slurring. But we called 911, and I got to Northwestern probably in 10 or 15 minutes, probably because I was downtown in Cook County, and they immediately took care of me. By the time before I got in the hospital, they started putting pressure things on my legs, and I was literally upside down. And they rolled me right into the ER. And one thing I did learn, if I can digress just a moment, for you brothers and sisters that might be attacked, have a brain attack, you want to make sure that you go to a facility that has an emergency stroke unit. A lot of hospitals don't. They might have an emergency room, but they don't have the equipment, nor do they have the staff. They don't have a neurologist. They don't have a heart doctor. They don't have the nurses that are trained to follow these procedures. And a lot of people, that's precious time that's wasted. I think we got a 3-hour window once the symptoms start presenting themselves. But it was determined I had a stroke. I had it on the right side, which totally weakened my left side, which was my dominant side. And that really kind of freaked me out. I maintained my cool, but I was concerned about my future, obviously. I knew something. I've been around stroke folks, not at the incident, but I had been around them, so I saw some of the behaviors. But I knew I had a stroke, and it was going to be a recovery period. I was lucky that the Northwestern University has a Recovery Institute of Chicago, which is one of the best. As a military guy, it's so good when we can't fix our soldiers and sailors and airmen and Marines, we send them to RIC. And that's traumatic brain injury, loss of foot, loss of limbs and extremities, and so forth and so on. So I got treatment there. I was in ICU for like 30 days. I started my OT and PT, my occupational therapy and physical therapy. And I was trying really hard. I'm a soldier. Tell me what's expected. And if you expect that I can do it, I might not do it the first time, but I'll do it subsequently. I'll go through a few dry runs. My recovery was working well. There were other guys in ICU that had strokes, and they were in a pit, having a pity party. I was getting up trying to walk. In fact, they called me a runner. They put an alarm around my belt because I was still trying to get up and go to the bathroom and do the things that I normally do till I fell. And obviously, hospitals freak out when you fall on their property. But I went through 30 days of OTPT, and I walked out of the hospital at the end of that OTPT. Before I walked out, one of my therapists, in fact, my attending physician, says, you've shown a lot of progress, and you might benefit, or we might benefit, the whole community might benefit for you participating in a study, which I agreed to. And it was a study of neuroplasticity, which suggests that the brain, even though it's been damaged, certain pathways and certain other connectors have been damaged. But the brain and your limbs, your body already knows how to do stuff. It's just got to find another way to do it. It's like going down a detour. And Dr. Harvey, the professor at Northwestern that conducted the study, his theory was that electricity, or a little energy at the site of the damage, at the site of the blockage. I had an ischemic stroke, so there was a blockage. His theory was that a shot of electricity in the right spot would activate some nerves or some brain activity that had been damaged. And we found out that it worked. The process was to get therapy, from a nurse, try to do certain things that would be tested. We would determine whether or not I could do it. I would get the electricity, and then go back and try to do the same tasks that I attempted to do before the therapy. I was able to do the tasks. So my recovery, I'm still undergoing recovery. That was in 2009. I didn't drive for 2 years, but I did go back to work. My concern was, and as I said earlier, or maybe I didn't, I was left-handed. I'd been left-handed all my life. I was an old guy. Everything I did was left-handed, tie, hygiene, eating, and so forth and so on. And I couldn't do it. And that really freaked me out. But God is kind of interesting. He does miracles. And after I went back to work, I developed those skills with my right hand. I'm not as good at my writing. My penmanship is not great at all. But I can work. I am writing. I do drive. I've even danced a bit. But it was a life-changing event. I'm a different person. And I'm glad to be here. And I'm certainly glad to be with you other survivors.
Likewise.
Thank you so much, Darryl. I appreciate you for sharing the story. Dr. Kinney, in interest of time, so we could go ahead and get through these questions, I'd like you to just share your experience, and then sort of what was your recovery process like? And can you speak to the TIA versus ischemic, those different forms of stroke?
Okay. I can be brief. I was sitting there 2 days before Halloween. I was doing something for the kids, and somebody had brought me over some sushi, and I was like, oh, it doesn't feel right. You can just have to have it, and that I never do that to sushi. I always eat my sushi. There's writing seemed to be coming off of him. I don't know why the writing was coming off of him, but above his head, the writing just started. I was reading and the writing started falling off. And I was like, okay, you know what? I'm just gonna lay down right here. That's all it, he said, oh, okay. Just give me a few minutes. And I laid down, and then I got back up, and then I don't know if what I said to him made sense. I said, I got to go to the bathroom. Could you help me up? And he helped me to the bathroom. He went out and he came back and knocked on the door. Are you all right? I said, I can't get up. I think something's not working right. And he said, I said, no, just don't worry about it though. I'm just gonna lay back down. And so when he would have called the ambulance, but I told him not to. I told him no, because I didn't want to be sick. I didn't want to be somebody's problem. That's what and knowing that I just sorry, there's something going on outside. Okay. So that it took me about 5 o'clock in the morning. So it was maybe from 9 to 5 that I was just like, oh, just let me rest. No, just let me rest. And I just all I wanted to do was sleep. And when I got to the hospital, I don't know what happened, who came, I did my little thank yous, but I think I left somebody out. But the doctors came, my doctor, because I knew a lot of them. They came and said hi and all this sort of thing. And for 3 days I was asleep. So I slept for 3 days, and I was like, whew. When I woke up, I was like, okay, all right, somebody tell me what's going on. I already knew that. I still didn't think stroke. I didn't think stroke until, they explained it to me. And I was like, man, but I'm a doctor. I shouldn't have these problems, I come back from Africa. I said I was going to do that a little later. I'm going to work on it a little later. And it just didn't become a little later. the way that I thought I was gonna get, I was in the hospital for a month. Not the hospital, and then they sent me to rehab, and then I I actually wanted to know when I was going to get out of here. I just can't be in a place like this because I was a physician and I wasn't supposed to be here. And he said, "Hey, when you start walking, you can go." So in 2 weeks I walked, and so the thing about it, I had what's called an ischemic stroke. It's when there's no blood flow to the brain. So in a little part of the brain that your little brains, I mean the little cells can get to, it can no longer get to there. And so they also sometimes people have thrombotic strokes. Is when blood clot forms inside the artery, but I didn't have one of those. It's either embolic or thrombotic. Most people have ischemic, and that's what I had. And it's a little hole, and the doctor showed me, just a little teeny. It was just so small, but and of course I didn't get treated like treated with certain different platelets or antiplatelets because it had been over 8 hours. So, it had been over 8 hours and I could not take it at that point. So, and that's about what happened to me. So
what's the difference between what's TIA? What's the difference with that and the other stroke? You said ischemic and embolic, right?
Okay, ischemic and embolic. One is it's really just referring to when embolic stroke is when a plaque or clot travels from the heart and leads to a brain blockage, and then thrombotic stroke is when a plaque or a clot forms inside the artery in the brain, and then it blocks blood flow to the artery. So that's the difference between it. That's why, whatever it is, we just there's also an ischemic stroke, and it's less common but more deadly. It's the one that people are scared of, and of the hemorrhagic stroke is intracerebral and subarachnoid, and those are just different places in the blood. And a hemorrhagic stroke, the brain bursts and gets bigger, in your brain. So it's
swells. Yeah.
deadly. So
I want to take this back to Cayman. Like, now that we know that you can't prepare for a stroke, but having experienced this, what would you have liked to know, or what do you think would have helped you? If you had to go through it again, what are the things that you would want somebody to know to be able to prepare for recovery, as well as what they may go through?
Man, I don't know. I don't know how I would answer that question. And the reason why I say that is because you can never prepare for it. But the thing that I would tell somebody is to pay attention to the signals that your body gives you. And listening to Dr. Kinney, I kept saying that it was a man thing, but it seems like what people have said for many years, that doctors make the worst patients, because like somebody like her actually knows what they're looking for. They know the signs, but she too ignored them.
Mm-hmm.
She did the same exact thing. So I think the message in all of this, and I listened to the Darryl talk. Daryl's mouth was twisted before he had his stroke. So Darryl, let me ask you, and not to take over the job, Rael, but let me ask you, Darryl, when your mouth was twisted the first time, did you ever think stroke?
My mouth didn't get deformed until the actual stroke. The TIA is transient. It moves. It doesn't really do damage per se,
Right.
but it is a precursor to what could happen. And that's what, after I had the stroke and started doing research on it, That's what I found, that many people that have stroke subsequently have this episode that we call a TIA, a transient ischemic activity. As I said, I spent the night in the hospital. They didn't find a thing.
Right.
About a month later, I did have a stroke. So that paired out with me. But the day at Cook County in my office, my friend came in and he says, "Hey, yeah, I think you had a stroke, brother. Your mouth is all twisted."
Wow.
So
is there anything that you could have done between like experiencing TIA and actually experiencing stroke that
I don't think so, because nobody told me to do anything. They didn't even identify what had happened, because they were not a facility that had that knowledge. I didn't go to I went to a regular hospital that night where 911 took me, and they admitted me and had they had no clue really.
They needed a neurologist. They needed a
neurologist. They needed a heart doctor. They needed the equipment. They had none of that. So they told me nothing. And it wasn't until subsequently that I had the stroke that when they were getting my history, I said, well, I had an event. I was in the hospital about 30 days ago. Well, how'd you feel? I felt like I had vertigo. I was dizzy.
Wow.
So
and the vertigo doesn't usually come with the stroke.
Right.
It comes kind of like it did him before. And you may not, and that's why be fast is what they tell you to learn, where you can tells you to know these things, to know the sudden and severe headache. So B is balance. Eyes, you feel you can't see, you're kind of, and then you can. Trouble seeing in both eyes. You have sudden dizziness. You have trouble walking. Your face, that's when you something, your face should typically, it goes one way or it's not, it's not normal. And your arms are also, arm or leg, those are weak. You couldn't hold your pencil, remember?
Yeah.
And then your speech is one of the last things. It goes, blah, 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 and then the time that it takes for you to call and get there. It really is important. I think if I had gotten there faster, I wouldn't have. I have my whole left side of my body that was paralyzed, and it's not paralyzed now, but there is damage. There's still damage to my left leg, and now nobody can see it. I'm still in PT, which is physical therapy, when they kind of tell you what you should be doing, what your body should be doing. But so be fast about it.
So my question, the next question was, what is the physical therapy or occupational therapy like for stroke? What are your recovery process?
Okay, you talking to me?
I'm talking to you. Then Darryl, it seems like Cayman, you didn't really. Are you still in physical therapy or occupational therapy? Are you still recovering, or do you feel like you're fully back to being who you were before the stroke, Cayman?
Me?
Yeah.
So I only went to one physical therapy appointment. And
yeah.
He told me I didn't need to come back, so I haven't really had any therapy.
But do you feel fully recovered? Or?
Yeah. I mean, for the most part, I operate at 100%.
Okay.
Like I said, the only real downfall I have is the mental part of it all.
Okay.
Because sometimes when you just sitting there like, dang, it changes your life, because now I haven't been cleared to drive. So it's almost like I have to be dependent on somebody else. Like, can you come take me to my doctor's appointment? And that's, that to me is like the whole mental aspect of it. I feel fine physically, which is like, just listening to everybody else's story. And it kind of goes back to the whole important message in this whole thing is to pay attention to the signals. I would never ignore anything ever again. I promise you that. I was so in denial, like I said, this is not happening to me. It's not happening. I never thought stroke.
I think it's interesting that you and Dr. Kinney are both under 50. just teetering on the line of 50, but to be so young, I wonder if that also had an effect of you thinking that nothing could be wrong.
Yeah. I believe so, man. I believe so, because they have so many things that's in place, as far as ages is concerned, like go get tested for this when you turn this specific age, but it just goes to show you that life is so unpredictable. We can never predict what's going to happen in life. Just like you save money, hoping that you'll get old enough to retire. Everything that we do in life is a faith journey. You walk into a room, you say, man, I hope you don't go in there saying, I hope this floor don't fall, but we never know. We never know. And that's the one thing that I learned. That's the first time I've ever spent the night in a hospital.
Me too.
Yeah. And and it's humbling. It makes you look at life a lot differently. And like I said, if anything that comes out of this whole journey, it makes you appreciate the life, because there's no guarantee that you'll live to get old.
Can I jump in?
Yes.
One of the things one of the medications, and I take many at this point, I've been treated for a mood disorder. I have actually suffered from depression. And I think that's something that a lot of physicians and survivors of stroke don't recognize, that the mental stress, the mental associated with your body changing and the damages and so forth and so on, not driving and not doing those things that one desires to do, can cause your mood to change. And I not only have I been in war, but I was not really treated until I said, hey, I cry, I go through things. Yeah. And I do take mood pills daily. So you might want to consider that as a part of something. Also, I'm starting therapy again because my gait has gotten worse. I might be getting off on a tangent, but I am starting therapy again because my mobility has been arrested based on the events, 4 years of a plague and then 2 years of COVID. I haven't been moving around. I don't think y'all got that. 4 years of a plague. Somebody's going to ask me, what kind of plague? We know. Okay.
I know what you're saying.
Okay. But there's something you really might want to contact your primary care or a social or a psychologist or a social worker or something, and just talk about how you feel. Not so much the physical thing, but what's going on in your head.
Yeah.
And that might give you some relief. I've counseled some people that I've come in contact with that had strokes, and I say, hey, you might want to, what I just advise you to do, tell your doctor that you're sad. You're not feeling chipper like you used to.
Yeah.
Yeah.
And they might be able to do something. Doc,
just to think about things that we need to do. There's even though there's the things that can help us on the psychological end, there's the clot busters, there's blood thinners, there's stents, and there's our carotidectomy. Endorectomy is what we haven't talked about. And I just want to tell people that, there's other things you can do if you do it fast. If you can do it in a
timely manner.
Just timely manner. Yeah.
Yeah.
So, Darryl, we didn't get to the prostate cancer, but I'm curious, how were you diagnosed? We know there's the PSA test that creates early recognition. There's the digital rectal exam as well. What was it like being diagnosed with prostate cancer? Take us through that journey, if you don't mind.
Let me say, talking about mental stuff, let me tell you about cancer. The worst thing about having cancer is knowing you got it. Mm-hmm. You want to talk about something that'll mess with your mind. That's been my issue. Mm-hmm. It was discovered that I work for the Navy. I'm retired from the Army. There's a federal hospital here at VA, so I take quarterly blood tests and so forth and so on. My PSA numbers went up significantly, not really high, but significantly enough for my physician to refer me to the oncologist. And they basically told me they wanted to do a biopsy, which is not pleasant. especially for a man, because they go up your rectum with a device that is as big as a yardstick that's got a tool at the end of it that takes the samples, and they have to take 15 samples. But it's like a stapler going off in your butt, and I'm conscious. But once it was determined that there were cancer cells, they put me on a regimen of active surveillance, which means it just the blood tests, and my job was to observe my body, any changes. For example, I just had to take a toilet break. Urination is frequent. That whole physiology changes a little bit as the cancer grows, and it is growing. So I've been scheduled to take another biopsy, which they're going to have to knock me out for that, because I'll knock the doctor out if I'm awake. But
do they have some type of numbing agent or something, like when they were doing the biopsy?
If they did, I didn't feel it. But all I felt was that stick. Okay, that's what I felt, and I made a complaint. I said, "I'm a black man. You don't do that. You know." And it was unnecessary. I said, "I've had colonoscopies with a small piece of stainless steel stuff, and they knock you out. You gonna stick a stick up my butt with a tool in it?" So that's what they did. I'm sorry, excuse my candor, but that's exactly what happened. But my numbers have gone up. I've had a MRI on the prostate, and there is growth, there is spreading, and I anticipate being scheduled for. I know I'm going to have another biopsy, and then the plan is, depending on what they find, the plan is to start me on radiation. And I assume that if it's not this month, it'll be sometime next month. The VA does not do that here. So there's a hospital in Milwaukee that they've got a relationship with, and they'll do those processes. Did you ask me that, or?
Is it correct that you're currently on some experimental drugs, participating in a clinical trial right now?
I am not, but I will.
Okay.
I've been invited. The normal regimen for radiation treatment, as I understand it, is like 5 treatments initially, and once a week, 5 weeks or something like that. There's an attempt, or there's a thought that one could they could up the dose of the radiation and cut the time down that it takes to be administered the therapy. So I'm not involved with a study now, but I will, and I do that because Black people are underrepresented in medical studies, as well as academic and other social studies. And when I was offered, even with the stroke, I accepted it because I knew that I was representative of a whole lot of folks that were overrepresented in getting strokes. And we had even a higher death rate as a result of it. We're 50% more of having a stroke than other men and women, but we're 70% more likely to die from it. So as I became aware of stuff, that kind of motivated me to participate in the study, and I had additional therapy. So it was a win-win situation all the way around, and I do believe in those.
Well, I'm wishing you the best.
Thank you,
Dr. Kinney. Seeing your bio and knowing that you were part of the Center for Cancer Disparities. Do you have any insight that you would like to share with us about prostate cancer?
I can give you a couple of things. I know that cancer has been higher in African American, prostate cancer even has been higher in African Americans. They say that one way to deal with it is vitamin D. Vitamin D is one of the things that they're looking at for African American men. And one of his name is Adam Murphy. I say go. He's I don't know where he works, but he's a doctor. He's a neurologist. I'm not a neurologist. Urologist. Dr. Murphy is working hard on learning about cancer, and they're learning, it's coming out with good things. And I know that from talking to him and that sort of thing. But prostate cancer, I really don't talk about it because it's really a male thing.
Okay.
And when men get to talking, y'all talk. but really, the right now, everybody should be on some kind of vitamin D, so.
One of the questions I had, are there any books that you guys have read about stroke or prostate cancer that you think would provide some insight for our listeners?
Let me make a strong recommendation. The U.S. Department of Health and Human Services has an Office of Minority Health. Much of the stuff that I looked at about both of my conditions came out of that office, the Office of Minority Health. And again, it's the U.S. Department of HHS, Health and Human Services. That's their job, to do these studies and to report. They're a public entity, and everything I've read has come to pass, has come to fruition based on what I've read from them. I've read some other books, but I find that these from HHS are probably having the most impact on my understanding of what's going
on. Were you guys on? I know, Dr. Kinney, you were already on some type of medication regimen. What about you, Darryl and Cayman?
I've been on medication since the stroke.
What about before the stroke?
No, I retired from the Army. I was in pretty good shape.
I was on what did they have me on? They had me on Losartan, Losartan, and when after the stroke, they had me on 3 different medications. Okay. So, which I got it down to 2 because I don't think they did it right, and I got it down to 3 medications, and yeah, that's and so, see, y'all see that.
Take your time.
You should always be taking baby aspirin. If you're over 50, which I am soon to be, you're taking a baby aspirin.
Is that on a daily basis, or
yeah, that's on a daily basis. It's just a pal, take a baby aspirin, and that was told to me by a neurologist.
All right, and Cayman.
Yeah, it's so much back and forth with everything. You hear it's good and you hear it's bad. It's so much stuff. But I've been on blood pressure medications prior to the stroke.
Okay.
I've gotten rid of one of them. I'm taking an anti-seizure medication, Keppra, now, and I take warfarin, which I should be weaning off of in the next few weeks.
So you had high blood pressure. That is a risk factor for stroke, correct?
Yeah, it is.
Okay.
Did
anybody tell you about the risk of having high blood pressure, or is that something that you more or less?
I know. Trust me, I know what it is.
Okay.
I know, but my blood pressure has been controlled, and like as of now, I still don't even know the why I had the stroke. So there's certain things that I'll still be tested for. Like my next test will be for protein S. Everything else came back normal. So, I've been asked, did you have a vaccine before within a month's time of me having an event, because they thought it could have been a VITT, a vaccine-induced thrombotic event. But my platelet count was normal the whole time I was in the hospital. So usually your platelet count presents low, when you have a VITT. So I still don't know what it was.
Wow.
Well, your blood pressure was probably pretty high when you had the stroke. I didn't know I had blood pressure issues. I have them now, though. But the day they took me in the hospital, my blood pressure was like 200 something.
Oh, wow. Mine wasn't that high, but he said it was high.
No, mine was 200 something.
I don't like going to the hospital. So, of course, I had anxiety about that. And then I had taken the ibuprofen on top of that, which is bad for people that got high blood pressure. So
Well, I would like to say, so the factors are age. Of course, I've already said age, gender. Women are at higher risk of getting a stroke. Ethnicity, of course, African American have 2 times the risk stroke of white people. Whether you have had it before, and your family history. There are factors that you can change. Smoking, everybody, we love high blood pressure, cholesterol, heart disease, lack of exercise, which we are still are now we thinking good about exercise these days, obesity, blood sugar, which is diabetes, irregular heartbeat, AFib, um, um, excess alcohol, too much alcohol, and sleep apnea and clotting conditions. Those are things that we can change, and risk factors for stroke.
Is stroke increasing, or has this always been an issue? And what factors do you, if it is increasing, what factors do you think are contributing to that?
It's always been the same. It's looking at, unless except if you look at it and think, are we smoking more? Are we drinking more? Are we exercising more? Those are the things that if they're not doing it, then of course it rises. If they are doing it, then it lowers. What was the last question you asked?
I was asking just how what factors have caused the increase, but it's pretty much the same as it always has been.
Yeah.
We're just becoming more aware of strokes now. Okay.
As a resident old guy, I think the rate's going to even go higher, and I think stress has something to do with that. And I think we've had perpetual stress. We've got, Black people have PTSD, and the whole country's got it. Behaviors change, just the things that we've been through. Like I said, 4 years of a plague, 2 years of COVID. Now we got a war with the Russians and the Ukrainians. There's stress there, and I think that, I can't prove it, but I do believe that the stress that I suffered just dealing with my personal issue with my family and moving here and planning for the trip to China, I think that stress contributed to my high blood pressure. I wasn't diagnosed with high blood pressure until after I had the stroke. The whole time I was in the Army, I never had high blood pressure, or at least I wasn't informed that I did.
Yeah.
I wasn't treated for it anyway. But I think that I think we're gonna find ourselves, unless we get on a regimen of vitamin D or somebody has a miraculous treatment that keeps everybody at bay. But I think that stroke and other maladies, diabetes, type 2 diabetes, there seems to be a higher incidence. I've got that too. Didn't have any of that before I had the stroke. The type 2 diabetes, high blood pressure, and now prostate cancer. I think a lot of that's environmental. I think a lot of that is based on pollutants in the air, what we consume, not only alcohol, but even the kind of food that we eat. I've tried to stay away from that. I told you I tried to stay away from chicken. I had that TIA and Popeye. Ain't had no Popeye. That's late. Don't even smell it. And I thought that's what made me sick, just that smell. But unfortunately, I think there's going to be a higher incidence, and America's not, one of the things that COVID kind of showed the rest of us is that America is not on top of it, all medicine. We're not necessarily the best prepared. If that was the case, why do we have a higher death rate than other countries due to COVID? And we're not the most populated, and we're a first world country.
Hey, man. There's a lot. That's a whole different show right there, because there's a whole lot of stuff that's sold in America that's banned in a whole lot of other countries.
That's
so
right.
That's a whole nother show.
Right. So I just want to put that out there, but I believe the rate is going. I'm not. It's not my field, but I'm running it personally. You folks, I didn't know Dr. Kinney was a survivor, and I met Cayman, but I've had two women family members that I've been informed that they had strokes recently. These are relatively healthy women. I think that the incidence of strokes is going to go up.
But I'd like to give everybody a chance to make final remarks with sort of at the end of the hour. we'll start with you, Cayman. Are there any last things you like to share? I know that you are, by being a radio personality, naturally you're inquisitive. You know, you may have some questions for the guests that I haven't thought of, but take it away.
Not really, man. I don't want to take over the job, but my message is clear. I've said it like several times tonight. And if you got to walk away from anything that I say, please listen to the signs that your body gives you.
Mm-hmm.
I mean, they come up for a reason, man. They're indications that something is not right. And like Dr. Kinney and Darryl said, the faster you get treatment, the better off you'll be. That's my words, and I'm sticking to that.
All right.
You're here.
Darryl,
I agree with Cayman. You have to pay attention to what's going on, particularly as you age. A lot of things, because we men, we ignore. It's not cool to be sick or to be ill or to whatever we do. But I think you have to pay attention to your body. And as I get older, and as I said, I just turned 70 last month. I very much in tune with my body at this point.
Yeah.
I don't want it to get any worse, and it has gotten worse. But there was no symptomology of the cancer until. So you got to take your tests. You got to do your labs. A lot of us, for some reason, don't do that. Maybe we're not covered. Maybe we don't have access. But we do have to take those tests.
Or we just don't want to know.
And that is a problem. In some of the literature I've read, Black men particularly, or men specifically, but Black men particularly, are hesitant about going to physicians. I don't know if they think it's going to hurt, which it might.
Yeah.
Or it's going to reveal some bad information, which it certainly might, but better earlier than later.
Yeah.
Most of us don't get treated on the stroke thing until it's elevated, until it's metastasized.
Yeah.
And then we die. So,
all right, Dr. King.
Like I said, listen to your women because they know.
Yeah.
Very true.
You say listen to your women?
Yeah.
Okay. That's what I thought you said, Doc.
Hey, I'll accept that.
Yeah, I know you will.
And be fast, balance, eyes, face, arm, speech, and time. That'll get you there. Always in time.
Well, I thank our guests. I really appreciate it. I think this was a much needed, important conversation. Our next show, June 27th, What's Unsaid About Race at Work. Author, filmmaker, and MSNBC journalist Richard Louis recently published a report about DE&I programs and the state of race inside businesses. He'll be interviewed by DE&I specialist D.D. Lofton. And so with that said, first of all, this is Father's Day weekend and Juneteenth. In celebrating Juneteenth, we do not want our men to be overlooked. Every year for the last 33 years, Real Men Cook has promoted positive images of men in relationship to their families and communities. Real Men Cook has been celebrated all over the country, but we started in Chicago, and we will continue that tradition on Father's Day, June 19th, from 3 to 6. Men will literally cook and literally serve their community on Father's Day. So we want to special salute to all men, especially Black men. We realize that some of the myths are out there about our men, but the majority of us are just like Cayman and Darryl and myself, just here trying to do the best that we can. And, we want to uplift Black men on Father's Day, men in general, but Black men specifically, because that's what affects us in our community. And as we begin to uplift those positive images, maybe the youth will have something to look at, and that we'll have much better youth out there, especially, you guys have heard all the stuff that's going on in Chicago. That's happening too, but, we have great things happening as well. Great men. So with that, I forgot to mention that one of our advisory board members, Yvonne Rael, is also a stroke survivor, and she first experienced stroke at the age of 42. So this is, we know the age. We heard the age is a factor, but it's happens at very young age as well. So you should be aware. If you see any signs, don't hesitate to get to the hospital and call 911 and have someone do it for you. With that said, I want to turn the microphone over to Yvette Moyo, who is the founder of MOBE. Oh, I forgot to say thank you to AARP. Thank you, AARP, for giving us this, helping us continue to have these conversations. And we will be having these conversations in the future. Yvette, Mom, you can take the microphone and close this out. You have to take yourself off mute, and then we can hear you.
Thank you, Rael, son. Yes, Rael and I are related. Rael is the future of MOBE, Marketing Opportunities in Business and Entertainment. And he does serve on our executive committee. And our chairman, Curtis Simons, thinks he's the best guy in the world to do these programs. And I'm beginning to agree with him. Thank you so much for moderating, Rael. And you said everything that I was going to wrap up with, just that Father's Day and Juneteenth are inextricably tied together. One of the things that happened during slavery, and we really can't say Juneteenth without also saying slavery, because it takes the bite out of it. It sounds like a celebration rather than a annihilation of a people. And that was the intent, that after we were perceived to be a property, that we were no longer needed, and somehow we should not exist as true human beings participating in the American public, in the American way. And so it is Juneteenth, but it is also Father's Day, and nothing should take the backseat to us keeping our families intact and calling our families intact no matter what the configuration. Happy Father's Day.
Thank you.
Father's Day.
Thank you.
Thank you.
Happy Father's Day, fellas.
All right.
Well, sir.
Thank you, guys.
Thank you, Rael.
And happy Father's Day to you, Ken.
Thank you, sir.
All right.
Thank y'all for doing this too.
We appreciate it. Real Men Charities, if you want to look up and see what we've been doing, or Real Men Cook, that is also important as well. And we'll see you on the 27th at another MOBE Monday.
RealMenCharitiesInc.org. RealMenCharitiesInc.org is our website. So thank you. Have a great day.
Good night.
Good night.
Good night.
Can't